6:14 in this morning's Your Health Matters. It's one thing to learn that you have cancer, but imagine going through the treatment, overcoming the disease, and then learning that you've developed yet another health concern.
It's called lymphedema, and it can come on suddenly, even years later. I worked with photojournalist Bob Rhodes to introduce you to one woman who overcame lymphedema through specialized therapy. It was shocking enough for Lois Sudal to learn that she was diagnosed with breast cancer in 2008. So when she realized she was experiencing lymphedema after treatment, she was at a loss.
I didn't expect to get it, though. I thought I was being careful with my arm. I was doing my exercises. I thought I was doing everything I was supposed to be doing.
Lymphedema is an accumulation of swelling that can happen in most often a lymph, sometimes in the head or neck area after cancer treatment. In Lois's case, it was only a few weeks after her breast cancer treatment.
I noticed the back of my hand was swollen, and I called my oncologist immediately, and they had me come in that day.
Usually a patient will say that they have a feeling of heaviness in their arm, or sometimes it feels like they can't get their arm down to their side because there might be like a little swelling underneath the arm.
Kathy Bechtold is a certified lymphedema therapist with Munson Medical Center. She worked with Lois on a regular basis in therapy.
Treatment is going to be variable depending on the severity of the lymphedema. If they have mild lymphedema, or sometimes the doctors will just send them here for education, the visits can last anywhere from 3 to 4 times total, and we usually see them maybe once a week. If they have what we might call full-blown lymphedema, they need to be seen daily usually.
Kathy also did the lymph drainage on me and then trained me to do that every day at home.
What's also key to note is that people can get lymphedema at different times after cancer treatment, and there is currently no cure, but it can be properly managed.
There are 4 things that we do as part of complete decongestive therapy, and those are manual lymph drainage, which is a type of massage, which is very gentle to move the fluid from the areas where lymph is not being processed very well to areas where the lymph nodes are intact. We also do exercise to help pump lymph fluid and also to improve the range of motion of the shoulder and to strengthen the arm. And then we use compression bandages first and then garments as needed to decrease swelling and to keep it under control. And the 4th thing is instruction and education in how to protect their skin, because getting an infection can really make the lymphedema much worse.
I think as a breast cancer survivor, we always need to be aware that it's a possibility. Even if it doesn't happen right away, it can happen 20 years down the road. So I think it's always important to pay attention.
Now, just to note, lymphedema treatments usually last for an hour to an hour and a half, depending on the severity.
And for more information about the condition and ways to prevent it or treat it, you can go to our website, upnorthlive.com.